we are live with our heartbeats, and I'd love for you to welcome our next guest in our series of alternative medicine. So please introduce yourself, Dr. Gramath.
My name is Dr. Jennifer Gramath, and I have been in the field of oncology, mainstream medicine as a nurse, and then later went back to school to become a naturopathic doctor to help patients, whether they are trying to decide to do it all naturally or as an adjunctive therapy while they're going through chemotherapy, radiation, or surgery to keep their immune system strong so that they can withstand that type of treatment. And then also after they have finished that treatment to kind of strengthen them. And that's, I saw that working in oncology and integrative medicine and mainstream medicine was there's the gap.
Yes.
So with mainstream medicine, you're using very strong chemical drugs that really beat down your immune system, which is the very cause of cancer in the first place.
A decreased immune system. Yeah.
Right. And it's a factor of having a compromised immune system. You develop cancer and many chronic disease processes.
Yeah.
And so when you knock it down even further with chemotherapy or radiation, it almost guarantees a secondary occurrence of that same disease process because they have no immunity to fight it.
That's right.
And then, so that's where they kind of just leave you in mainstream oncology is, okay, we've done the chemotherapy, radiation, and the patients are looking at them and saying, what next?
Yeah.
And so that's what I do, is I help patients to know exactly what are those next steps into getting my health back, and to be as healthy as I possibly can. We call it you're at your optimal health level.
Yes.
And so that's a different picture for everybody, but we want them to be the very best. And so regardless if they're struggling with cancer, diabetes, heart disease, Lyme disease, which is just on the rise.
Yeah, you've mentioned Lyme disease a little bit more. Could you tell us what Lyme disease is and how it affects our body or our immune system?
Yeah, most definitely. Lyme disease, most people know it as a tick infection.
Right.
Okay.
And I thought you only got it if you were out
lived in Lyme,
in the woods. And, yeah.
So that's what, and everybody thinks that, and that's very common, but that is not the case. You can contract Lyme disease from ticks, most definitely, from mosquitoes, from sand fleas. So it doesn't matter if you're on the beach or if in the mountains, you can contract this. And what happens is most of us have exposure to it. But it is only when our immune system is functioning at this level and our toxic burden is at this level that we become symptomatic from it. It's just another burden on the body's immune system. It can't handle it. And so what happens, it creates inflammation. It gets into different organs, glands, and tissues, and it multiplies it. So it just kind of takes over. It's just an infection that kind of takes over, creates a lot of bizarre symptoms. And it's such a complex disease process.
It seems like it's hard to diagnose because what you describe is common in most diseases.
Yeah, because you can have symptoms from just having joint pain and inflammation to fatigue to brain fog to neuromuscular disorders. And so it can look, everybody can have the same diagnosis, but have complete different look of symptoms. And that's why it's very difficult to diagnose. So
Dr. Jennifer, I wanted to ask, with I can imagine you started out as an RN oncology nurse and just saw how it seems as though your heart was just so full that people just didn't know what the next step is. I want to call you the next step. You are Dr. Next Step.
That's a good one. I'll have to remember that.
So as the next step, you saw that, hey, people were healing, but that people were getting, the cancer maybe was decreasing, but it wasn't getting better. And I'm sure there was a lot of emotional issues that still continue to compromise the immune system, because if we're sad and we're depressed and we have these negative thoughts, that further compromises the immune system. And so what in your practice do you do that helps them with the next step?
Right. So we look at the root cause, and there's many root causes. I'll tell you a little bit about my story, Sharon, because I was a traditional nurse I worked in cardiology, internal medicine, and in oncology.
Mhm.
And my father developed lymphoma cancer. And so I was just used to seeing people come in for therapy. They get weak, they get sick. Some survive, most don't.
Mhm.
And it was a very depressing, atmosphere. And I tried to be a light and encourage and, pray for and, do
Mhm.
all that I could do.
Right.
My father developed lymphoma cancer. He had the size of tumors that were like oranges under his arms, like,
Mm.
grapefruit in his
Mm.
abdomen. He was a crop duster and had the chemicals directly sprayed on him, the pesticides that are on the
Yes.
foods that we eat.
Yes.
And he developed this after that. And that's what the oncologists were saying his cause of his non-Hodgkin's
Mm.
lymphoma was from. And so, of course, we did chemotherapy and radiation. It destroyed my father's heart. He was in his early 50s.
Oh my
And
goodness.
the
Mhm.
doctor said, I'm sorry, there's nothing else we can do. You need to go home and get your affairs in order. And I
Mhm.
was completely devastated
Devastated.
because
Mhm.
got into nursing to help people, and especially my family. By the grace of God, my medical director, he pulled me aside and he said, Jennifer, he said, why don't you try alternative medicine? I thought he was nuts. I said, if it
Yeah.
was legit, I'd have learned about it in school. And,
Cool. That's
I
right.
was just, but I didn't, I prayed and I prayed and I prayed and I said, Lord, just lead me. And this is what he did. He led me to this doctor and then to a guy who had cured himself of a brain tumor in Chattanooga, Tennessee. A
Mm.
very rare. So I was very impressed with the results because I never knew anybody that survived this. And he was like many years post brain, cancer and thriving. And so he put my father on all these supplements, did all these bizarre therapies. My father lived past the 2-month point. 6 months, he was back working. Tumors
Wow.
had shrunk half their size. A year later, he was cancer free. It
Wow.
changed my whole look on life. So I'm still working in the field of oncology and I'm researching alternative, what
Yeah.
it was called then. Today it's functional medicine.
Medicine. Yeah.
I'm researching that, and I had to go with, going back to school, becoming a naturopath, and work in a different way with patients. So I value our medical system and the fact that they are the best system for acute care, but
Yes.
they lack tremendously in dealing with chronic disease
Right.
process.
Right. And so, just for our audience, acute care is short term, chronic is long term. Um, Thank you for sharing that. And I wish Dr. Next Step was there for me. Both my parents were died off of cancer, um, both bone related. My father with bone cancer and my mother with bone marrow. She had multiple myeloma. And so I was just getting into functional medicine alternative care at the time. But when both of them were diagnosed, they were at the 4th stage. So even my mother wasn't able to even get chemo. And they just did radiation just because they wanted to do something. And so 2 months to the date of her diagnosis, she made her transition. And my father, they just kept on telling him it was something else. And then the next thing you know, they amputated a leg, and then the next thing you know, that he was in hospice. So yeah, so just even being aware of the various modalities that are out there. What are some of the modalities that you use to help?
So that's different. Yeah. So I really address it at the foundational level. Your lymphatic system is the system that contains your immune system. And so I didn't know anything about the lymphatic system in nursing. We had a chapter or two on it.
Yeah.
Every other system of the body, it was a textbook. And so it wasn't until I became a naturopathic doctor working with cancer patients, and typically most of my patients come in stage 4.
Really?
I had an osteomyeloma patient that doctors, did all that they could do for him. They gave him a month to live. He lived 17 years
What?
after the
Oh
diagnosis.
my gosh. That's
So,
beautiful.
there is hope. I
There
mean,
is
it doesn't
hope.
matter what stage you're in. I prefer people coming before they're in that
Right.
state, but we never give up. We never
Yeah.
give up. And so one of the things that I found really quickly is that as naturopaths or as functional practitioners, we are constantly, of course, changing the diet because it's your lifestyle.
Thank you for saying that.
Causes,
Yeah.
95% of all disease processes
Yeah.
from the lifestyle. 5% is genetics. So we can't use
Only
genetics.
5%?
Only 5% is gene
Really?
related.
Okay.
And so it's 95% diet, lifestyle, 5% genetic. And I study genetics and I help patients understand their genetic SNPs and things like that.
Yeah.
But I don't ever want to, take the focus and blame and just put the blame on the genes when it's really, we can do so much with the diet and lifestyle. So changing the diet's number one. You got to look at, your deficiencies, and that's the biggest part of the problem. It is the fact that people are eating lots of sugar and processed food. So you need to eliminate them, but you can't stop there. You can pull those out and still be very, very sick because you're not getting the critical nutrients your body needs.
Okay.
And studies today show that each individual, especially Americans, we need 15 servings of fruits and vegetables a day to maintain health. 15.
So how do we get the 15 in, Dr. Gramath? 15.
Juicing. Yeah, you're eating it and you're juicing because it is almost impossible. But that just shows you that 30 years ago, the statistics or the studies showed that it was like, 7 to 8 servings, and now it's 15.
Remember 15.
Our food is devoid of nutrients, so we're having to eat more and more. And if you study Dr. Zach Bush's work and looking at the farmland and the quality of our fruits and vegetables, it's going downhill fast. So that's going to increase. You're going to need better nutrition. And then I saw that there was an issue with the overwhelming congestion in the lymphatic system. And so what happens with that, and more than 70% of Americans walk around with a high percentage of congestion in their lymphatic system. And that's due to the sedentary lifestyle. It's due to stress and hormone imbalance. But if I'm trying to boost their immune system, and their immune system is contained within the lymphatic system, it's kind of like your armies, your Marines. If you stick them in a lake with, lots of murky water and, just stagnant, and try to battle, it's very difficult because you slow down your immune response. You can't get to the battlefield fast enough. Your enemy can go right by you because you can't see them. So we blinded our immune system. And that's why we have all these autoimmune diseases, because your immune system's trying to do its job, but it can't see. It's just too congested. And so I found that by using assisted lymphatic therapy, I could dissolve the inflammation and congestion in the lymphatic system. So I developed a piece of equipment called the XP2 to do that. And now I train doctors and practitioners all over the world for this therapy and certify them, and they do this in their practice. And it just helps direct the immune system to the problem area. It removes the inflammation, which is always, the root of the problem. And so that's one component. That's the foundation of what we do here at Right Way. But then later, about just a few years after becoming a naturopath and getting into this field, I started to see that there's a huge connection between emotional trauma and disease process.
Absolutely.
So you can't ignore it.
You can't ignore it.
We deal with the emotional stress and trauma by helping our clients to realize where they're downloading that into the body. And so when you don't allow yourself to grieve, or you don't allow yourself to process trauma. It gets downloaded as pretty much as a safety mechanism to protect you into your tissue. And that's where disease develops. And if you study
here, heartbeats, you got it from Dr. Jennifer. That is my platform. And thank you for reiterating that. I am a firm advocate, and I just can't tell you people enough of how much we need to be able to manage our emotions, how we need to be able to navigate it into positive avenues so that we can increase not only our immune system, but it gives us overall health, the excellent quality of health, and excellent love life, and excellent health. I mean, that's the core for me. That's the core. That's what Three Hearts, One Beat is about, dealing with the physical and how the physical and emotions impact each other. And then we are able to uplift our divine self through doing great health, self-care, love care, spiritual wellness activities daily. And so thank you for reiterating that. Dr. Jennifer, you have already even answered a lot of my questions, because I was going to ask you, what are some tips that you can tell us that we need to do to help keep our immune systems? And also, along with what you were saying, lymphatic draining, I've recently had lymphatic massage therapy along with that, because I realize how if our lymph nodes are congested, then that will increase, especially during this time. So before you give us your information and how we can locate you and take advantage of the different modalities that you have, what are some other things that we can do besides making sure we get the 15 servings? And then I'm going to do another talk about that, because there are many ways, and people these days just fill themselves with supplements. So when they hear you say that they take all these supplements that have all these fillers and that really are not, so it's one thing to take nutrients, but I also understand is how these nutrients are absorbed into your bloodstream, and when you should be taking them, and what you should be taking them with. So I think a lot of people say, well, yeah, I take my vitamin C. Oh, yeah, but it's water soluble. Oh, yeah, and a big thing is, oh, I take turmeric, but turmeric is fat soluble, so they don't realize how these things really interact with the body. Could you just give us a little?
Yeah, most definitely. I think so many people think we rely on supplements for nutrition, and they're called supplements for a reason.
Yeah.
They supplement where you can't get it from your diet. And so it's not a good replacement. You need to get as much as you can through your diet, because it's whole, it's complete, it has everything you need.
Yeah.
And then supplement where you can. Vitamin C, for instance, there's different sources of vitamin C. So the over-the-counter ester C, it only enters into the cell through one pathway, and it has to stand in line with all of your other vitamins. So you may take it and get zero absorption from it, okay? Because it does you no good if it doesn't go intracellular. Liposomal vitamin C goes in the cell through two pathways. So you're more likely to get absorption from that. And then there's also a vitamin C called Vitality C from American Nutraceutical that actually is the closest to an IV vitamin C that's oral, because it uses a sodium glucose carrier. And so it goes through four pathways into the cell, so guaranteed absorption. So if you're going to take vitamin C, take the right type of vitamin C. However, it really depends on your diet and lifestyle, and you just really need to know what your deficiencies are. You don't need to be taking, hundreds of supplements and thinking that your body knows what to do with those, because like you said, there's a lot of fillers in some, and, it's quality too. However, too, a lot of supplements will create die-offs. So like if it's an antimicrobial supplement, and your lymphatic system's already congested and you're killing off more, you're making more congestion. That's why you feel so terrible when you take it. It's doing its job. But if you would open up those detox pathways first and then do it, you won't have that healing crisis that so many people experience. But, I think people need to know, probably the most important thing I would say that you can do for yourself is pay attention your physical symptoms and learn what emotional root is behind them. I had a patient come in who was, sitting in my office, and she was rubbing her legs and she was in so much pain. Her doctor had diagnosed her with chronic fibromyalgia. And I asked her, I said, well, do you care if I test you and see? And it was 100% emotional. So
wow.
when I said that, and then when I tested her and found out it had to come from a male source, she knew exactly her son had tried to commit suicide, and he was a vegetable now, and she's caring for him, and he's very angry. Her symptoms occurred right after his incident, and we released the emotions associated with her son, and the pain disappeared immediately. Walked out of the office with no pain.
That's right.
These symptoms we have, like losing your vision. What is it in your life you don't want to see?
You don't want to see, absolutely.
You're losing your hearing. What is it you don't want to hear?
Absolutely.
And so, these are your internal systems. You're like your little red light, like on your car, that's saying, hey, pay attention to me.
Pay attention, caution, absolutely.
So taking some time to sit every day and just feel your body and feel where you have tension, where you have pain, and then just ask, what is the emotion associated with this, and it will come to you.
It will come, or you can always come to a coach like me, or you can always go to Dr. Jennifer Gramath, and she can also assist you on that if you're finding it difficult to figure that out. So thank you for sharing, Dr. Jennifer. I'm calling you Dr. Jennifer, Dr. Gramath.
Whatever you want.
Before you leave, I do have 3 particular questions that I always like to ask my guests. And the first one is what do you do to take care of your heart?
I do a lot of recall healing and emotion code. So daily I get up. I have a practice of doing the emotion code where
I'm familiar with it, yes.
Use kinesiology. I ask if there's any trapped emotions in my body today and how I can release them. And so I do that. And that's what I teach patients to do too, because I want them to become their own doctor.
Yes, because we can heal ourselves. We just have to find people like yourself that can help be our guardian and give us some, guidance around how to do that. And we can definitely learn to heal ourselves.
The definition of a doctor is a teacher. Doctors are only supposed to be teachers.
That's right.
And so we have to teach people, how to identify these things so that they can take care of themselves, because you can't do it all.
That is a wonderful message. Doctors are to teach, not to tell, but to teach. And we can do a whole other thing around that. So my second question for you is, you ready for this one? What is the one lesson you have learned about being in love or a relationship?
One lesson I've learned about being in love for what?
Or a relationship, or in a relationship.
Sometimes the most loving thing to do is to take care of yourself. I have so many, and I'm guilty of this too, is that we think the most loving thing to do for others is to sacrifice our own health, become martyrs, and that there's some kind of greatness in that. And I don't believe that's what God meant. We are to care for ourselves and not feel guilty about that, so that we can have the energy, the mindset, the vitality to care for others. And that's something I think everybody struggles with, especially in the South, when you're raised to, just make sure everybody else is good, and just deny your own physical, needs. And so there's balance to that. And I see that so often that, it's the disease process is from just giving, and not rejuvenating yourself.
Yeah, I get that so much in my practice, where a lot of women give too much and receive too little. And so just learning balance and, what reciprocal love is, reciprocity is in giving is a big lesson that we all need to learn. And my last question is, what do you do to uplift your spiritual self?
Pray.
There we go. There we have it. Thank you so much, Dr. Jennifer Gramath with the Right Way and Wellness.
Right
And
Way Health and Wellness.
Health
Yeah.
and Wellness. Tell us again how people can contact you.
Well, you can go to our website, rightwayhealthandwellness.com. You can check out all the different services that we have. You can call the office at 404-474-2100. I will, for any of your listeners, if they want just a free consultation, I'll be happy to give them if they have some issues and they just need some advice, especially when it's dealing with chronic disease. They can just mention that they saw me on your show, and they can do it. I do telemedicine because I do this type of testing and all over the country for other practitioners. So it can be online or it can be in office. And those are the best ways to reach me.
Thank you so much. Thank you. I look forward to meeting you in person instead of virtually, and also taking doing some of the lymphatic draining, because we're trying to stay healthy. And definitely,
that's right, Sharon. You come in and you can receive a complimentary session.
Oh, look at that! See, all right. Thank you so much, Dr. Jennifer Gramath. We look forward to talking with you again soon. All right. Have an absolutely wonderful, beautiful, positive day.